Why are there different hysterectomy types for reproductive cancer? Why do we have different types of hysterectomies when it comes to reproductive cancer? The answer lies in the complexity of reproductive cancers, which can vary greatly in their location, stage, and how much they have spread. Each type of hysterectomy is designed to effectively remove cancer while trying to preserve as much healthy tissue and function as possible. The choice of which hysterectomy to perform primarily depends on the type of cancer, such as cervical or endometrial cancer, how far it has spread, and the overall health and treatment goals of the patient. One key reason for different hysterectomy types is the extent of cancer involvement. A simple or total hysterectomy removes the entire uterus and cervix. This approach is often sufficient for early-stage cancers that are confined to the uterus or cervix. The goal here is to remove the cancer while minimizing the removal of surrounding tissues. On the other hand, a radical hysterectomy is more extensive. It removes the uterus, cervix, upper vagina, and surrounding tissues, including pelvic lymph nodes. This type is typically used for cancers that have spread beyond the uterus or cervix, such as advanced cervical cancer. The aim is to ensure complete removal of cancerous tissue and reduce the risk of recurrence. Another important factor is the preservation of ovaries and fallopian tubes. Depending on the type of cancer and the patient's factors, such as age and menopausal status, these organs may be removed or preserved. For instance, in some cases of cervical cancer, if the ovaries are not involved, they may be left intact to help prevent early menopause. The surgical approach also varies. An abdominal hysterectomy, which involves an open incision, is often used when cancer has spread extensively or the uterus is enlarged. This method allows direct access to pelvic organs and lymph nodes. In contrast, a vaginal hysterectomy is less invasive, with no external incision, leading to faster recovery. However, it may not be suitable for all cancer cases, especially when extensive tissue removal is needed. Minimally invasive techniques, such as laparoscopic or robotic surgery, are increasingly used for suitable cases to reduce recovery time and complications. The type and stage of cancer also influence the choice of hysterectomy. In cervical cancer, a radical hysterectomy is common for early-stage invasive disease to remove all potentially affected tissues. In cases of endometrial cancer, a total hysterectomy is the standard approach, while a radical hysterectomy is reserved for cases where cancer has spread to the cervix or surrounding tissues. Some types of hysterectomy, like subtotal or supracervical, are generally avoided in cancer treatment because they may leave behind cancerous tissue. In summary, the different types of hysterectomy reflected the need to balance complete cancer removal with the preservation of normal anatomy and function. The surgical plan is individualized based on the cancer's characteristics, the patient's health, and treatment goals. This tailored approach aims to optimize outcomes while minimizing unnecessary removal of healthy tissue. Always remember, consulting healthcare professionals is essential for personalized medical advice and treatment options.